Studio with New York Times best-selling author John Gilstrap.
Good morning.
Speaking at 5:30 this evening at the library at Shepherd.
Yes, Scarborough Library.
And Mr. Bodwell, Johnny the Bod, and Michele Terwillier from Bodwell Insurance Solutions. This is our annual Medicare show.
Good morning.
And if you have a question in the Facebook section, you can post it for us, or you can call 263-6540 or 263-6586 if you have a question about your Medicare or potential Medicare in the future. Tracy Regalia, we'll start off with a question from Tracy right away here. It's kind of a statement question. No copay if you have Medigap, correct?
If you have a Medigap Plan F or Plan G, there is no copay. Plan F, you pay nothing. Plan G, which is the most common one now, all you pay is the Part B deductible, which is one time for the year. It's going to be $280 next year. Then you can have $1 million plus worth of medical, and you will pay absolutely nothing. If you select a Medicare Supplement Plan N has some copays. It has lower premium than G, has some copays, but still Plan N, you do not have a network. You can go to any doctor in America that takes Medicare.
Hope that answered your question there, right? Very good.
Medicare is just, it is very confusing, and I have seniors tell me that all the time, and I always say, thank you, and I'm very glad the government made it that way so I can have a job.
Sure.
If somebody decide, they say, okay, I want to go with an Advantage plan, and then like in March they say, no, I don't like this, I want to switch back. Can they do that?
Great question. Medicare Supplement, you have 3 months before you turn 65, 3 months after, or when you go on Part B, if you delay Part B because you're working, to go into a Medicare Supplement plan without any medical questions. Outside of that time, it is medically underwritten. What they basically want to do is they don't want, it's like homeowners insurance. If the roof is already on fire, you don't get a new policy, okay? Medicare Advantage is like dating. You can change your Medicare Advantage plan every year. Medicare Supplement, if you have any sort of medical issues, you're not going to be able to change supplements, only change to Advantage. And we actually have a lot more people on Medicare Supplement who are looking at Advantage this year because of the rate hikes on the supplement plans. And I will tell you, the federal government has done something really good with that. There is what is called a trial right. If you are on a Medicare Supplement plan, you can go to Medicare Advantage for 1 year, and during that year, you can go back to your Medicare Supplement plan with no medical questions. Gives you a chance to try it out.
That's scary.
Well, I've had a lot of people switch from Medicare Supplement to Medicare Advantage just because a lot of them were in the older Plan F, which is very, very expensive. I was running into people who were paying, $300, $350 a month plus their drug plan. So they were paying $5,000 a year, and these were people that were healthy that switched to a Medicare Advantage plan where all of a sudden they didn't have that kind of out-of-pocket. I mean, the general rule of thumb is if you are healthier than the average bear, you will save a lot of money on Medicare Advantage. And it adds in some dental, some vision, some hearing. If you're of average health, you will still save money on Medicare Advantage. If you are catastrophically ill, chemotherapy, in and out of the hospital all the time, a lot of medical issues, you will spend more money on Medicare Advantage than you do on Medicare Supplement. But we have no way of knowing usually what our health is going to be moving forward. If somebody comes to me and they're turning 65 and they've got an active cancer, I tell them, look, you need to go into a Medicare Supplement plan. A couple of years down the road when you're healthy, you could switch to an Advantage plan and save that premium. But for now, you don't want any restrictions. You want to be able to go anywhere. And the cancer could take you to your maximum out of pocket right away, where the Medicare Supplement premium, you end up paying about $2,000 a year between the supplement and the drug plan when you turn 65, and it goes up as you get older.
If somebody is in the Medicare Advantage plan and they do, God forbid, get a cancer, and the best cancer doctor for that is at the Mayo Clinic, can they go there?
If their plan will take it. If that doctor is in their plan, or if it's a PPO plan, PPO plans have out-of-network benefits. It'll have a little bit higher of a maximum out-of-pocket. A lot of PPO plans have like a $10,000 maximum out-of-pocket in or out of network. So they would just be paying a higher maximum out-of-pocket. If they're in an HMO plan, which is much more restrictive, you can only go to doctors that are in that plan's network.
And how about in a supplement plan? Is it the same thing?
Supplement plan, you can go anywhere. Supplement plan, any doctor, any hospital, any facility in America that takes Medicare, by law, has to take your Medicare supplement. So you have a lot more freedom, but you pay for that freedom.
Let's talk about people who are 65 but still working and they have a health plan at work. Are they, generally speaking, better off switching to Medicare or keeping their own personal health insurance?
That is a great question. Generally, they are much better off switching to Medicare, and so is their company. I mean, the company is paying, usually $10,000 to $15,000 a year for the health insurance for that person, not including whatever the part of the premium that they're paying is. And generally, the work insurance plans have, $2,000-$3,000 deductibles that they have to meet when anything major happens, and then from there, they're paying, 80-20 up to a maximum out of pocket that is probably very similar to the maximum out of pocket on a Medicare Advantage. Or with a Medicare supplement, they're not paying anything. And between the Medicare premium, where the Part B premium for next year is going up to $206 a month, everybody pays $206 a month unless they have what is called an IRMA, which means you make more than the average American, and the government will charge you as such because that's what the government does. They charge people for success. But you'll pay that $206. You can get into a Medicare supplement plan for about $150 a month at the age of 65. Throw another $50 on for the average drug plan. That's actually a little more than the average, but say $200 a month plus the $206. For $406 a month in a Medicare Plan G, you can basically have a maximum out-of-pocket on the medical side of $280 for the year. And chances are you are paying more than $400 a month as your part of your group insurance, and then you have a $2,000 deductible. And that's if you go to Medicare Supplement. If you go to Medicare Advantage and you choose a zero premium Medicare Advantage plan, you are paying $206 a month, which is the Part B premium, and you're not paying another premium, so you're paying $206 a month to have a plan that does not have a big deductible at the beginning.
So here's a follow-up question from Tracy. So is Medicap better than Advantage?
That is a great question. It's better for some people than Advantage. Some people can't afford the Medigap. It's called Medigap or Medicare Supplement. Some people would rather not pay premium. If you get sick, the Medicare Supplement, if you are catastrophically ill, the Medicare Supplement is definitely better coverage because you have no referrals, you have no pre-authorizations, except very small things within Medicare. You have no out-of-pocket costs, and you can go anywhere you want to. Any doctor, any hospital, any facility in America that takes Medicare will take your Medicare supplement plan.
Now here's another follow-up from Tracy, which is that if you choose Advantage, does that mean you can't go back to Medigap?
You can go back to Medigap if you choose. If you're in a Medigap and you leave, you've got that 1-year trial right where you can go back without medical questions. But if you choose to be in a Medicare Advantage plan and you want down the road, you want to go into Medigap or Medicare Supplement, those terms are synonymous, you will have to answer medical questions and you'll have to be approved.
Now, here's a question from Doreen, and we love Doreen because even when she went to Italy, she found a way to listen to this show.
Hi, Doreen. And Tracy, by the way, thank you very much for being my friend and asking questions and helping this segment along. And hello, Doreen.
If someone over 65, this is a good question. If someone over 65 has a child between the ages of 18 and 26, can they get on Medicare Advantage, a Medicare Advantage plan, and still cover their child like you could with your own personal health insurance?
You cannot cover, Medicare plans are single plans. You can't cover anyone else on your Medicare plan. But there are Obamacare plans the Affordable Care Act plans where anyone of any age would qualify to go into a plan. So we could insure that child without a problem, but they will not be a part of your Medicare plan because they don't have Medicare.
Is there an income test regards to your premium that goes back 2 years for how much you would pay in a premium for Medicare?
Yes, there is. Basically, what they do is they look at you in 2025. They look at your 2023 income, and I believe for this year it was 100. If a single person over 106,000 would pay an IRMA, they'd pay a little extra on the Part B and the Part D. 212 for a couple. And that goes back 2 years, and it's updated every year. It's a different number every year. But one of the great things about that the government does not talk about, I know everybody's going to find it surprising, there is an IRMA relief form, and we help our members, we help our clients with that. Because if you are, say, 2 years ago, say you made $300,000, you retire this year, okay, and you're making way less. We fill out a form and they get rid of the IRMA. They do it based on your income from now, okay, as a retiree. And that's, the government does not publicize that. I can't tell you the amount of people who do not know about that. Now, if it's one-time money that you've made, if you've sold 10 rental properties and you made $1 million 1 year, you will pay the IRMA for that year. It has to be a life-changing event.
Are you better off selling it before you get to 65?
I am not an accountant. We'll have to ask Financial Phil about that because that's more of an investment question. On the real estate side, if real estate keeps going up, you're making a little bit more on your real estate. You got to balance out what the IRMA will be.
Michele.
I wanted to speak on the ACA. We were talking about the Affordable Care Act with Obamacare. So one of the other things that's happening right now and why they have to do it at the exact same time, your annual enrollment period is starting October 15th through December 7th for Medicare. During the ACA time frame, you are getting ready to enroll there as well if you are anywhere from the ages of 18 up to age of 65. That can give you the independent health insurance.
That's for ACA.
So that's for the ACA side. So anyone that is a bartender, anyone that is a mechanic, a hairdresser, anyone that does not have small group health insurance through their company, you have to have health insurance. People say all of the time, I don't need it. Well, you do, because right when you say you don't need it is when you're going to have a gallbladder attack or, God forbid, something else. And I don't know why, but kidney stones have been the rage in West Virginia and at that city hospital recently. So if you have that attack, that can be so expensive to somebody who is literally working and that's just them. So we can make sure that they have a plan set aside just to make sure that it covers everything in case they have a problem.
Well, and it also, as far as the Affordable Care Act plans, it's November 1st through January 15th. Everybody who has a plan this year needs to review it because there were some changes. We don't know exactly what the changes are going to be, and that's why our government is shut down right now.
That's right.
Because the Trump administration decided to take away the extra. There were extra subsidies put into it during COVID, and they wanted to revert back to the subsidies that were there before COVID. The Democrats don't want that. So we don't know what's going to happen with the Affordable Care Act plans for the coming year. It's really up in the air.
But for Medicare, it starts October 15th?
Medicare is October 15th. But I will tell you this, if you are on an Affordable Care Act plan, when you turn 65, you need to be on Medicare the month you turn 65. Because the Affordable Care Act plans, A, they are not credible coverage for Medicare beneficiaries, but B, you lose your tax subsidy and you are paying full price from the time you turn 65, which at that age for a health insurance plan is somewhere between $1,600 and $2,000 a month.
Now let's get to those who are turning 65 this year. Do you get what is your official notification? Do you get a letter, and then where do you go to sign up?
If you are on Social Security, Medicare will sign you up. You'll be signed up automatically by Social Security into Medicare. If you are not, about 3 months before you turn 65, you need to go to socialsecurity.gov, into your Social Security account, or contact the Social Security Administration. And I mean contact your local office, or go online and set up a phone appointment. Do not try calling the Social Security national number. I always tell people.
How can you say that and not laugh when you even said that out loud?
I mean, Medicare will answer the phone in 5-10 minutes, and they're open 24 hours a day, 7 days a week. Social Security, you need to get a movie. And I always say not a romantic comedy. The movie I would select is Braveheart, because I think it went like 3.5, 4 hours. But you will sit on hold for them. That is how you sign up for Medicare. You sign up for Medicare through Social Security because they have to verify that you have your 40 quarters of work in America to qualify for no charge Part A. And that is also a service that we provide in our office at Aiken Center. If you want to come down and you have a socialsecurity.gov account, you can come down and one of our agents will walk you through signing up for Medicare. We've done it so often that it makes it easy. You want to do that about 3 months before you turn 65. And then what happens is Social Security signs you up. It goes over to Medicare. You get a Medicare card. And then you need to set up an appointment with an insurance agent to sit down and go through the various Medicare plans and make sure you have the coverage that's best for you.
Speaking of walking in and having someone look at your plan, we are a local resource center for reviewing all Medicare plans every Friday from 10 to 2 at 115 Aiken Center, Suite 10.
So just bring your policy in.
Bring your policy in. Bring in a list of your medications, a list of your doctors, so we can verify exactly what you have and what you need. One of the best things that I can say about Bodwell is our passion and to make sure that we personalize everyone's plan, because every single person is individual. And to your speak of what we were speaking of about the cancer, when you have a Medicare Advantage plan, there are plans that we have that you can partner up against that are ancillary products that literally can take upon for cancer specifically or hospital indemnity. That's a small little fee in the monthly payouts that can pay out massively at the end of the day. For instance, okay, so I'll be closer to the 55 double nickels next year. I don't have anything catastrophically unhealthy. So for myself, I took a $10,000 policy out just in case I was to get a cancer plan that would be something that would be invasive. Mm-hmm. $10,000, they're going to write me a check. That could help partner with work if I miss work. That could help if I need to pay a copay, if I had copays to pay out. So again, it can obviously vary for ages and types of things, but it gives you another buffer. So there's definitely misses that are happening with all of the Medicare plans, but there's things that we can help partner with, and we can look at that and personalize for each person.
We look to mitigate all risks. There are, like she was saying, there are ways to mitigate the risks of a Medicare Advantage plan to make it where there's not as much chance that somebody's going to hit a maximum out of pocket, because the most likely way somebody's hitting a maximum out of pocket is cancer. And it's going to happen to almost half of Americans. But we try to mitigate risks. And what we do is we educate people. We make sure they know what all of the options are, and we help them enroll in whatever they decide, whatever they feel is best. And we don't charge for our services. I get asked that constantly. What do I pay you? What do I owe you? Nothing. The insurance companies, they pay us. And it works great that way. And we get paid by all of the insurance companies, so we are not beholden to any one
3
company.
minutes left. So whatever really important points you need to make, this is the time to make it.
I just want to give them a really quick commercial because I have consulted with you.
Yes, sir.
And we sat down, and people who were worried about, it's insurance, your industry does not have the best reputation for sales. Sat down.
Except those who sponsor Eastern Panhandle Talk.
And in this case, you sat down, you said, I'm good. The plan is fine. You don't have to do anything. So you're not out there to make a sale. You're out there to help people. So they're good folks.
Thank you very much. I appreciate that. Well, I'll tell you, our philosophy is we just want to help people. Are we in business? Yes. Do we want to make a nice living? Yes. But we make a living, and we've grown, and we are the largest Medicare insurance agency in West Virginia. I have trained over 200 agents in my career to do what I do. But the reason we do that and the reason we grow is because we just care about people. I have people call me all the time and ask us questions, and I just answer them. They can be my client. They cannot be my client. If we sit down with somebody and they're in the best possible situation, I'm going to say, hey, you're fine. I've allayed your fears. You do not need anything. Please tell your friends and family about us, but you're good. And don't let somebody. I had a woman 2 weeks ago call me about her Medicare supplement, an older lady who's paying a decent amount of money and has a lot of health conditions. She said, I keep getting these calls and I think I'm going to switch. I said, don't. Are you happy? Can you afford the premium? She said, yes, I can afford it easily, but I keep hearing these things. If it ain't broke, don't fix it. It's taking care of your needs, and you're not going broke over it. Now, if somebody called me and said, I can't afford to eat because of my Medicare supplement premium, we're going to take a look at a Medicare Advantage plan that will cost them less, because even if they have health issues, hospital systems have programs for people of low income to not have to pay as much of their copays. We just want to take care of people. That's all we want to do.
What's the phone number for your business, Johnny?
304-2.
Mr. Bodwell, you wanted 20 seconds.
Yes, sir. Let me just say, Medicare is very important. There's nothing more important than your health. Call a local agent. Call us. Call another local agent. Make sure you get your plans reviewed, and make sure you do not get taken advantage of by the call centers. And make sure you have the coverage, because without the coverage, you're leaving yourself
and your
open.
20 seconds
for
is up. Thank you, sir.